Well, it's 9 o'clock and we got two more important people here, so I think we're ready to go for a meeting. I'd like to call the Neighbors of Dunn County Standing Committee to order. And call the roll. I see that everyone is here, including County Manager and Jenna Nutter. And Dr. Brown. Good morning. First thing to do, approval of minutes. Chris sent us the minutes and anybody?
I second.
Okay. Supervisor Witzel moved and Supervisor Breslin seconded. No discussion, it looks like. All in favor?
Aye.
Aye. Okay, thank you. Public comment, Dr. Brown?
No. Outside of the sneeze.
Oh, okay. No public comment then, and introduction of Neighbors of Dunn County Department Heads would be number 5 for our distant Carmen.
Good morning. I believe that 2 of our department heads are with Chris virtually at the Neighbors right now to introduce themselves. So.
Yep, they're both here. I have Dave Dreger right there on screen.
Good morning.
And he's our culinary mentor. And I have Carrie McKnight on screen right there. She is our dietitian, our registered dietitian at the facility.
Thank you. Yeah,
No.
we're trying to put faces with the names
Okay.
on our list of people here. So it's just kind of
Yeah.
nice to see that.
You mask for a minute.
Yeah. We cannot see them in the large screen.
If one of them could say something, I believe it pulls them up to the large screen.
Okay.
Oh,
Well, okay,
Yeah.
Dave, you want to introduce yourself?
could you do that
course,
again,
David.
please? I'm sorry.
Good morning. My name is Dave Dreger. I'm a certified dietary manager. I've been with the Neighbors for 1 year and 3 months.
Thank you. And
Hi, I'm Carrie McKnight. I'm the registered dietitian at the Neighbors, and I've been here for 28 years, I think.
Has it been, yeah.
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 A
Well,
long time.
wow. That's interesting that you didn't go through the dietitian program at Stout or,
No, I didn't. I actually went to UW-Madison.
no, okay, neat. Well, thank you for taking the time. Anybody on the committee have any questions for them? Okay, thank you very much.
Thanks.
And then Carmen, and feel free, you're off on vacation, to make it as short as you can so you can get back.
Thank you. I appreciate that. I will do my best. It's more that it's 2 hours earlier here. So I started it at 6:30 this morning. Okay, so my first agenda item, as always, is the Quality Assurance Steering Committee updates. So this committee met 2 weeks ago now, and we did our normal reports. This month's report was the quality of life quarterly reports. We go over the overall quality of life of our residents. So there's someone from every department on that committee that meets monthly, but we do a quarterly report for the overall Quality Assurance Steering Committee. So that was the report for this month. We also talked about flu vaccines as it is beginning flu season. So we talked with our medical director, Dr. Phillips, about his recommendations for when to give the flu vaccines. The current recommendations are anytime in October, so we will be planning to do that for our residents and staff in October. In addition to that, we also talked about the new COVID vaccine that is being dispersed as a different booster, which is supposed to be more effective for different variances. We do not have that available to us yet, but we will be receiving that soon. And we would be hoping to do that at the same time as the flu vaccine. It is an easier process to do both vaccines together instead of on different days. It takes extra nursing time and paperwork time and things like that. And with the new vaccine, it has said that you are able to give them both at the same time, just in different arms. Well, they said different appendages, but we typically give them in arms. So we would be able to do both at the same time for any residents or staff that would like to be vaccinated with for both flu and the new COVID variant or the new COVID vaccine as well. So that was the majority of our discussion. Any questions on quality assurance?
Doesn't look like it.
Okay, next we'll do the activities report, which I'll have Chris start, but then I also have more to report on that after he is finished as well.
Okay, so on the employment activity report for August, can kind of go down through the number of direct hire interviews versus agency interviews. We had 4 direct hire interviews versus 12 agency interviews. We had 4 positions offered. We had 4 positions accepted. None were offered at higher than a step 3 because there was no licensed staff that started. They were pretty much all either dietary or homemakers. I can go down through the resignation reasons. You know, we lost 1 full-time LPN. She refused to work as a CNA for 2 hours, decided to leave over that. We had a full-time LPN, had some issues with his Wisconsin license. He was licensed in Minnesota and he was here approximately, I think he had applied for his license about 90 days prior to resigning, and it still hadn't come through for the state of Wisconsin, and he didn't feel comfortable working without a Wisconsin nursing license, so he quit. We lost a full-time cook, a part-time food service worker, and for the reasons listed. We lost a couple of part-time homemakers. We go down to the open positions, those are adjusted with the hiring and people leaving. Active leave of absence stayed about the same. No work comp lost hours. And then number of hours, we did have an uptick in August, some additional positives and some issues with COVID. So about 87 shifts or just a hair under 800 hours of lost time. And that's also including if agency staff had become COVID positive or had symptoms. So any questions on the employment report? As Carmen said, she would jump in. She has some additional information.
You want to jump in first, Carmen, or
Sure,
questions?
I can do that. So there's a couple additional things to add for employment for this month. So as you're all aware, we had an assistant clinical mentor resign almost a month ago. So we are in the process of recruiting for that position. So we're in the middle of that process. We did conduct interviews last week. So we'll be working through that process over the next couple of weeks. In addition to that, myself, HR, so Jenna, as well as Chris Corpolo, the county manager, have been working on strategies for employment that are different than what we've done in the past. Had several meetings over the last couple of weeks for different ideas for working on both recruitment and retention for employment. So it's a primary focus of ours as always, but we've been having additional meetings recently about it. So we have looked at a few different options. A short list of them is equity adjustments for nursing staff, just to meet the increase of the competition of wages that is across every organization or every industry, but specifically through the nursing and healthcare industry. We're also going to be conducting a survey for staff regarding what they would see as being beneficial to help them stay employed at the neighbors or why they would contemplate leaving the neighbors. So doing an employment survey, as well as we will be pushing out, I believe Jenna said by the end of the week, an invitation to other county staff to help with some of the things that they can help with that you don't need to be a CNA or a nurse to do. Currently, the management team at the neighbors has been doing a lot of homemaking. We aren't only short CNAs and nurses, we're also short homemakers. So we've been doing cooking, cleaning, things like that as much as possible. But it is something that you don't need to be certified to do. You just need to be trained on how to do it. So we'll be opening that up to not only NDC staff, but also countywide staff, if anyone wanted to help out with things like serving breakfast or other meals or helping with dishes and things like that. And in addition to this, I know it's something we talked about at the executive meeting last week, or 2 weeks ago now. But in addition, we have been also working on the CNA training program. I know it was passed through at least the exec committee to work with putting a position out there for a CNA trainer. But we've also been working with the CNA Training Institute to see if that would be an option as well. So I've been in contact with the director of that to see if they could also have a program at the neighbors. That wouldn't be our internal program. It would be run through them, just we would house it at the neighbors. So I'm still working on the different options for a CNA training program as well.
Jenna, you wanted to say something?
Just wanted to chime in with regard to the volunteering to help with meal times and things like that. We initially are starting to roll that out only to salaried employees across the rest of the departments. Gets a little more complicated with hourly employees. If they're working outside of their shifts, it would be overtime and also just the back and forth in the payroll system and all of that. So initially starting with looking for volunteers that are currently exempt from overtime.
Thank you, Supervisor Bjork.
Thank you, Mike. I just have a question. Heard it a couple of times now where people are crossover working in different positions. And it seems to me that when staffing seems to be an issue at the neighbors, and the reason that you gave us for losing an LPN was that she did not want to work as a CNN for a couple of hours. I'd rather have you tell me that we had to pay somebody a little extra money to cover 2 hours in a shift or whatever it may be, than actually losing a person and going through the expense and time of rehiring an LPN. I'm not here to manage what you do, but it would seem to me that if this was not a government-run facility, but privately held and privately run, that they would assume that their main responsibility is to somehow keep their workers on the job and happy with their job. And if it costs $100 more or $200 more, then maybe we should talk about that. But it just seems odd to me that you would lose a person that, and the reason given was that she did not want to work at I assuming a lesser position, lesser pay for 2 hours. I mean, any comment you got, I don't care. It's
Thank you.
upsetting.
Thank you, Supervisor Bjork. Chris, are you there?
I am. I will add in, we've been pretty liberal when people are working outside of their normal scope. We generally try to bump them up to time and a half plus incentive. The one that left, I probably shouldn't even comment on that one.
Yeah, okay.
Yeah.
We understand that you can't say things about the place, but I think they are probably getting paid. I think perhaps it was the work. I don't know. Carmen?
Yeah, so they would be paid their normal wages, if not more. So they would be paid an incentive for helping pick up a shift or filling in wherever needed. We, at times, if we have an extra nurse on a shift, we might ask them to assist more with CNA work. If I believe this example was a night shift person. So we had an extra nurse, but we were short a CNA for a couple of hours. They would be still paid their nursing wages. We don't bump people down to a different wage, as well as an incentive to help with something that is outside their normal scope. So we do it. This is a last resort if we can't get anyone else to stay to work, even with offering incentives or any sort of additional pay. As Chris mentioned, we can do pickup incentives. We can do, well, if they're working overtime, things like that, we would be paying them more. This is in the moment, we had a call-in situation, or we had some sort of issue that we were short, that we needed someone to step in and help with something they don't normally do. This isn't, we're not intentionally having people scheduled outside of their normal scope. It's more of a all hands on deck when something happens situation, not a planned situation. So we asked this employee to help with a situation where we had an extra nurse, and they were not happy with that. So that's kind of a little bit more specific without getting too in the weeds about the specific person, but it was more of a helping out in an emergency situation, not a planned, we want them to be a CNA.
During their shift is, okay.
Her
Thank you.
normal shift, yes.
Yeah.
That kind of clears it up. That was a good question. I was wondering about the pay also. Any other questions on?
I do. I have a question. I have heard that nurses are working 16-hour shifts. Can you give me a status or what's going on with that?
So we do at times have nurses working 16-hour shifts if they pick up it's called a double shift. So it's them picking up a double shift or staying a partial of a second shift to cover about, typically we try to have people split half a shift. So if they're working their normal 8-hour shift, they might work half of the next shift, and the person coming in on the next shift would come in a little early. But at times they are picking up double shifts. So that would be a 16-hour shift. They are incentivized to pick up the shifts. If they would like to pick up a shift, they get an extra, it's called incentive pay or pickup pay. So it is more money for them to do that if a shift is open and they would like to pick up a shift. That does happen.
Because my concern would be like medication errors and that kind of thing going on. When they,
So it is legal to have them work 16-hour shifts. It's actually, the state of Wisconsin has a further range of that, but that is actually a fairly normal thing for nurses to work 16-hour shifts. That's not a unique thing to us to pick up an extra shift. Sometimes our normal shifts for some nurses are actually 12 hours. So they might just add on another 4, or if they were an 8-hour person and doing a double, but then they typically work less days in the week if they're working the extra long hours. So that changes off of the concerns of not enough sleep and things like that.
thank you.
Could I
Can I ask
follow up
just
on
a-
that question? Chris, you go ahead. You go first.
Yeah, kind of something different we've tried to with our agency staff. I've had some interest in kind of what they call a weekend warrior position. So they work every weekend. So they'll work a 16-hour shift on Saturday, 16-hour shift on Sunday, and then an 8-hour shift on either Friday or Monday to get to their 40. And then they have all week off. That's from what I'm hearing from agency, that's quite a popular shift that some people are wanting to do that. We have a few here that are doing that now. It's actually worked out really good because then they'll pick up during the week too, because they're off all week. Just kind of to circle back a little bit to the 16s. Yeah, I've had a few people from our staffing agency request that. So it's just a different playing field now than what it ever has been.
And that way those employees cover a more difficult shift to cover, which are the weekend shifts. People are less likely to pick up on a weekend and things like that. So then we're more guaranteed staff on a weekend shift as well. So it's been helpful.
Anything else? I have a question for Chris in the employment activity report. Part-time homemaker, no job coach available?
Yep, I can kind of try to briefly explain on that one. We had hired an employee through like a sheltered workshop situation that required a job coach. Unfortunately, all of their job coaches are refusing to work weekends. So we couldn't furnish a job coach here that comes from that agency, and it's covered through DVR. So it's just kind of an unfortunate situation that he couldn't stay, but they didn't have the staffing that was wanting to work every other weekend. So
Thank you.
you're welcome.
Okay, then I think Carmen, President referral report.
Okay,
So as Mike said, the resident or supervisor Kinnear said, the resident referral report. So as you can see, it has continued to show that we are not admitting residents. The residents that were admitted would be people going in and out, if they went to the hospital and came back to us. As well as we do have to count all transfers from one facility to another facility as an admission. So if someone is in the central building and then goes to the east or the west building, it is a full discharge and admission. Since we are separately licensed, if they move within one neighborhood, so if say they move from Fireside to Deerview in the central building, that is just a room change. But if they physically move to a different neighborhood, that is a discharge and an admission. So that is why there are admissions on there, but we have not admitted anyone from the outside unless they were our own person that was in the hospital, that we sent out to the hospital and came back as an admission. So we have not had any new admissions. As you can see, the numbers on this sheet are a little bit higher than what we would have today, as this is from August. So it's a little bit behind. But at the beginning of August, we had 106 residents. We had 125 referrals. So as you can see, that's not changing. We're having continued increase of referrals. That is due to most nursing homes not accepting at this time for various reasons, whether that be COVID situations or staffing situations at other nursing homes as well. So hospitals are having a very hard time discharging patients to facilities for rehab care as well as for long-term care. So we are seeing that high number of referrals. The 6 admissions, as I already explained, and then we had 119 people not admitted to the facility. At the end of August, we had 104 residents in the facility. We had 2 residents transferred to another facility that were out of the area. We had 2 deaths and we had 5 discharges. Our referral sources were the same. We are still getting ones from other further away. Rochester is another big one that we get a lot of referrals from as well. Currently, our census is at 99 residents. So we are continuing to go down in census as we have not been admitting, and as people discharge or pass away, our census will continue to decrease. We currently have 2 households closed. Since our last meeting, we did close Fireside, which is one of the other short-term rehab household in the central building. So Arrowhead has been closed for nearly 2 years now, since the beginning of COVID pretty much. And then we have also now closed Fireside. So neither of our short-term rehab households are open. We have been moving all of the residents that were in Fireside to different houses on campus, or discharging if it was appropriate, if it was time for them to go home for therapy and things like that. The only safe discharges, we've moved everybody else to different facilities and on our campus. Whether that be moving internally in the central building to Deerview or to east and west. So as I mentioned, those would all be admissions and discharges to the different facilities. So that skews the numbers a little bit and is a lengthy process for the admission staff as well as the nursing staff as well to get them in their new homes on campus. Questions about referrals at all?
Anyone? I think not, so you can go ahead.
Okay. Next on the agenda, I believe would be Scott's report for environmental and facilities.
Good morning, everyone. I guess first I wanted to follow up with, from the last meeting, we had talked about our survey in East building. Since our last meeting, we have arranged for the enunciator panels to be installed in both East and West buildings. So that puts us back into compliance in East. And then the West building is ready to go for when we have our West survey. They can't cite us on not having that enunciator panel installed. And one of the other sites on the East survey was running generators for 4 hours every 3 years. Brady has went ahead and got that done. So that's taken care of for our 3-year period. Other than that, I'm currently recruiting for a contracted custodian again. There was one that we had that there were issues with, she did leave us. So I'm recruiting through Express for a contracted custodian. The other update to the facility is that I'm having the vending machines that are currently in the building removed. And we have added Better For You vending machine in this building, couple machines. Also in the highway shop, they have a vending machine there. So we're putting 2 machines in central building, 1 in east, 1 in west in the employee break rooms. This company gives a better variety of selections in their machines, and they also offer a card reader on their machines. Makes it more convenient for staff when they are at work. They don't have to worry about cash. They can slide their card. And also this company we were working with, they had a few different tiers of setup for the pricing, and we elected to go with the cheapest price for the employee. So the employee has a better price for example, in this building, when we had the Coca-Cola owned machine in there, 20-ounce bottles of soda were $2. In this machine now, 20-ounce bottles of soda are $1.50. So it helps out the employee. So making it more convenient, and that should go over good. People were very interested when we sent out pictures from this building for the machines of getting them into the neighbors. So that's finally happening. And last, I started looking into the specs for a bus. So start the process so that if everything gets approved for 23, we would be able to pull the plug and order a bus and get that on order, because that takes a while to get. But looking into the specs and getting the paperwork, the preliminary stuff done for that. Other than that, with the starting of the change of seasons, we'll be finishing up our ground care as far as mowing and that, and start switching to getting ready for the white stuff for when it comes, hopefully a long time from now. That is all I have this morning. Any questions?
Yes, Chris, great.
Scott, is it your staff are also helping pick up some of the cleaning activities?
So working on trying to have some staff do that. I'm recruiting with Express also for some staff to clean resident rooms. And I should have one starting Monday for that, so that should help out.
So Scott, do you have, for your vending machines, do you have different companies that are gonna put their stuff in the machines? Or is it just gonna be Coke or?
No, this is one company.
Okay.
It's a vending machine company, and they put in a variety of items. So they'll do a Coke products, Pepsi products, other alternative products. Yeah. And there's some healthier things in there. And then they also offer some meal choices. So like, say if a nurse is working a 16-hour shift, she doesn't have to leave the facility. She can grab something out of the machine if she wants. It'll be something cold, warm up in a microwave or something like that, but the convenience is there.
Can Don, Supervisor Keeter?
I was just curious on the vending machines, do they charge us to put them in, or do they work off their profits then?
They work off their profits. We are
Sure.
not charged to put them in
Okay.
at all.
That's what I thought, but thank you.
Yeah, I'd like to follow up on what Chris brought up.
Mhm.
That sounds like some brainstorming has been going on. You mean hire people to clean resident rooms? Like, is it usually regular neighbors staff that do it?
So normally there are the homemakers that will clean in the resident rooms. And with the shortage of homemakers, Carmen and I did discuss about having my custodial staff that is currently over at the neighbors forego cleaning in offices and do resident rooms. Neither one of those custodians were really big on the idea of that, and that in turn ended up with the loss of the one custodian. Even though we met with them, nothing was brought up, but then it came out later that they were not comfortable doing that. And then this particular custodian, you know, offered that she would be back to doing her same stuff, and she elected to not come back. She didn't feel, she felt embarrassed by the situation, didn't want to come back. So then I talked it over with Carmen some more, and we decided that we would recruit for a couple of express employees to clean in rooms only, which that worked out well so far. Like I said, I should have one starting Monday. I have another interview on Friday for an employee. So if I can get a couple people hired for that, they can clean in resident rooms only, help out the situation over at the neighbors.
So I can add something if I have.
Go ahead, yeah.
The main reason that this came up as an idea was when we are short homemakers, management staff has been serving meals and cooking and doing that situation, which is half of the homemaker job. The other half is the resident room cleanings. So on days that they're, say, if I serve breakfast in a household and lunch in a household, I'm doing that for the quick time during the meals and then going back to my regular job. But the rooms aren't necessarily getting cleaned that day. So then they'd be cleaned the next day that there's a true homemaker there. So we're doing the immediate need of feeding the residents, getting the meals out there, but not doing the full job, which we're making. Now we want to make sure that those rooms are getting cleaned as well for the residents. So this would be to basically supplement when there's other people doing the meal service to help the homemakers so that it's not extra work on the days that they are there.
Yeah, thank you. Sounds like an interesting plan. Does that mean that you have to take something out of your budget for?
Those staff would be charged back to the neighbors.
Okay. Thank you, Scott.
Thank you.
I guess on to the next one. COVID-19 update, Carmen?
Sure. So COVID-19 update, I talked a little bit about what we talked about in QA regarding COVID-19, mainly regarding the new vaccine that has come out and our plan for administering that. As I said before, we haven't gotten that yet, but that would be our plan as soon as we're able to acquire that from pharmacy. I do know public health has gotten some doses, but not enough to vaccinate everyone that would want it at this time, unless that has changed this week. But when I talked to KT last week, I know she did have some available, but we are hoping to get it internally as well from our pharmacy. In terms of COVID-19 outbreaks, we have had an increase in COVID-19 in the past couple of weeks in both staff and residents. I believe when we had our last meeting, we discussed the outbreak starting in the East building. This outbreak in one of our households was a slow burn outbreak. So typically what we have seen is one person gets it, and if it's going to spread, it spreads immediately. This time we had it seemingly every time we tested, there was a new person with COVID. So it was a lengthy process, but as of this week, we are going to be out of that outbreak. So we're happy to be clear of that in that household. But we have had other staff test positive in different neighborhoods. So we do have one other outbreak going on right now in the central building. No residents affected by this outbreak at this time, but we have had a couple of staff members test positive. So that is our only current outbreak. The fortunate news with outbreaks recently is that they've been less severe for illness. Most of the time, the majority of our residents, we don't even know they have COVID until we test them because someone around them had COVID. And then they test positive, but are typically asymptomatic is the majority of our residents we have seen at this time. So comparatively speaking to a couple of years ago when we had our first COVID outbreaks, people are doing much better than they were at that time. So that is a positive. It is a lot of work and stress for staff and residents when we have COVID outbreaks. But fortunately, people are not getting as ill as they were in the past. So any questions related to COVID?
It doesn't look like it.
All right. So that completes my regular report. Any other questions for me before we go on to the other stuff?
Mike?
Yeah, Supervisor Bjork has a
Thank you,
question.
Mr. Chairman. I just want to make a comment to Chris and with your personnel issues. And, I just jumped to conclusions that an LPN would leave because they had to take a cut in pay. And Carmen and Chris, I applaud you for the job that you do. Not only having to deal with people's egos, but you also have to fight in stressful situation with something you can't see or smell or see in the COVID. So I commend you on your job and apologize for thinking the only reason someone would bail out is they were asked to do something and not get paid for it. So.
No, I appreciate, that's nice to hear. I do appreciate that. The one that did quit, she was kind of dancing on the edge at the first place. So I don't think there could have been anything to salvage that one, even if that would have happened. So.
Okay, thank you. So let's go on to 7A then.
Okay, so Jane is also out, so I will be going over financials. So you all have the vouchers. I don't know if there was any questions on any of the vouchers at all.
I did have a question. If you have them right there, it's on page 6, but State of Wisconsin Pool Help is the title. You could maybe just explain what that is.
Sure. So that is the program that we had for CNA agency help through the state of Wisconsin that ended in August. So we had a contract basically with the state of Wisconsin to get pool staff acquired through the state at a cheaper rate than what we would get directly through the agencies. So then we would pay part of the rate and the state of Wisconsin paid the rest. So we paid the state basically, and then the state paid the agency. So we didn't get directly billed from the agency. And many of those invoices, they did not send to us very timely. And then we also, with the turnover in staff of who is processing them. So there's a lot on there, and that's true for all of the agency providers this month because we were backlogged. So you'll see that in the agency report as well, that last month we had almost nothing just due to billing and processing of invoices. And then this month we had a lot just to catch up.
Thank you. I kind of had a hunch, but and that's all done, you said in August, huh?
Correct. Yes, the state program finished in the end of August. So all of the staff that were from that agency left, and then we do not have a contract with the state anymore. They ended all of the program, the whole program ended. So it's not just our contract with them. They ended it with all of the nursing homes in the state.
Okay, and we got a chance to see the financial statements.
Mhm.
So you might not have to go through as much as Jane might
Sure.
in the situation we have here. But if you want to make a comment first, then we can, if we have questions or whatever you'd like to do, but don't feel like you have to spend a lot of time on them today.
Okay, the only thing I kind of mentioned it already, the agency pool staff report looks a little odd just due to the couple of months that weren't really processed for things. And then so a month, August looks way worse than the other months, but it does kind of even out a little bit, as well as all of those state ones were processed from basically the whole time they were here. So the summer they hadn't been sending them to us, and they then went to finance instead of to us, and it was kind of a mess. So that was higher due to cleaning up that process and getting those paid. And then besides that, the only other thing that I would look specifically at is the census sheet. As you can see, our census has gone down, but we did have we've been doing okay in some of the categories, especially Med A, which was nice. Even with our census being down, we had more Med A residents because we did have some rehab residents. The other thing that is kind of makes that a little bit off compared to different situations is when someone has COVID-19, we can code them as Medicare A because they can receive different therapies and things like that. So it is covered by Med A as if they were a new admit, even if they're internal, because it's a significant change of condition. So Our Med A census went up when we had COVID positive residents, because for 10 days while they're on isolation, because doing the isolation and all of the precautions that COVID requires is expensive. So we can code higher for Med A because they're on isolation. So that is why our Medicare A census is up, even though our short-term rehab households are closed. I think that is all I had specifically to point out. If there is any questions, I can attempt to answer them.
Any questions on the review of vouchers and financial reports? Okay, then I will take a motion to accept the vouchers. Okay, Chris, did you get that? Or
No, I did not. Who?
Carly moved and Don seconded.
Okay, thank you.
All in favor? Aye. I saw unanimous. Thank you. 7B.
All right, so this was at the request of the supervisor, the chairman Kinnear, for fiscal year 2023 census. So currently, our budgeted census for 2023 is significantly higher than what we are averaging right now. We had done this in part of in past learned mistakes, I guess we could say, from one year that we had budgeted quite significantly lower and as more of a realistic budget number. And then we had exceeded that quite significantly and had to do a bunch of budget adjustments throughout the year because our expenses were higher, but our revenues were also higher. So when our budget goes up and down, or our census goes up and down, it affects our budget drastically when it comes to both expenses and revenues. And the year that we did think we were doing the right thing by budgeting very conservatively and keeping our census number low, we then happened to have one of our best years census wise, and then we're way over budget for both expenses and revenues. Supervisor or Chairman Kinnear did ask that we address this because our census number is quite a bit higher and look at potentially lowering that for fiscal year 2023 and doing the adjustments that would be necessary. So he had requested to have it on the agenda as a discussion item that could have action if need be. So I don't know if anyone has questions on this or thoughts. If so, we would just have to adjust our budget for the coming year for both expenses and revenues.
Okay, thank you, Carmen. I kind of wanted the committee to look at it because this is something that affects the entire budget, as she says. You know, if we think we're going to get 100 people every month that are going to be living here, or living at the neighbors, we know what our budget would be. So this year we budgeted for 87%, I think, occupancy rate, and we're hit at 73% right now. But I think 87 is lower than the previous year. So we have been adjusting it. I kind of want the committee to know that this is a key number. And as Carmen said, if you get too low and then you make too much money, it's difficult. Now, at this point in time, I spoke with Jane Hansen, and it can be changed. The budget, it's 85%, right? I keep looking for Carmen over here. Yeah. So for 2023, Carmen decided that, and Jane said, go from 87 down to 85. I kind of wanted you to be aware of that. I'm satisfied with the number, Carmen, but if someone in the committee thinks that they should be closer to reality, I'd like you to have a chance to talk about it.
What was the lowest? 73?
Oh, 73 is what our occupancy rate is right now.
Averaging for this year, correct?
Yeah.
I can add that when we do, as you can see with our financials, we do adjust as much as we can accordingly as it's happening. So when our census goes down, yes, our revenue does go down, but our expenses do as well. The big difference would be any overhead that occurs. So the building, heating, staff that don't really change depending on census, things like that, insurance, all of those things, it would be the overhead that doesn't change when census goes down. But when our census is down, we then do adjust anything else that, obviously staffing, and then food, medical supplies, things like that do go down as well.
Yes, thank you, Supervisor.
Yeah.
Okay, first Supervisor Keeter, then Supervisor Breslin.
I was just wondering, from the budgeting process, is it better at the end of the year to come out with a little profit or a loss? Which one is easier to rectify at the end?
So it would be better to have a profit, because then that money then does go back to the county. Currently, it's actually another agenda item, but currently the profit goes back to the general fund if we do have a profit. The bigger issue is when we, at about halfway through the year, get to the end of our budget limits. This is what occurred the last time, is that it was probably August timeframe, I believe, we were starting to hit budget limits for expenses on things like food and medical supplies. Because we had such a high census throughout the year, our overall budget was maxed out. So the actual income loss or profit was still kind of the same. It just, our actual numbers of dollars in and out were higher than what we anticipated. But the margin was the same.
Thank you, Supervisor Breslin.
Do we anticipate opening up Arrowhead anytime soon, or will that be closed for most of next year?
We will remain having the households closed as long as we are still having the staffing concerns.
Okay, so then it would make sense to lower the census a little bit, just to come a little bit closer in line with reality. Thank you.
Supervisor Witzel.
Yeah, I was just gonna say, so are there?
Wait.
two-
Wait, is it on? Right side, push the right side button.
Yeah. That's what we're doing. You wanna go on? So what's going on? There we go. Now I forgot my question. So do we have two buildings down or just one?
We have 2 households closed. So in each building, there are 3 households. So on campus, we have a total of 9 households. Currently, we have 7 in operation. So all 3 buildings are open. Just one of the 3 only has 1 household open.
Okay.
Supervisor Bjork.
Thank you, Mr. Chair. As we move forward, possibly, I mean, it looks to me that we're going to have CNA training. Does that have any effect on your population numbers? I mean, I don't know what room you need for CNA training. Is there any correlation to census and CNA training?
The correlation would be a hope at this time that if we had CNA training, that would have more staff that would sign on with us then as employees. So then that would hopefully increase our staffing and have a better staffing situation. And then eventually, hopefully we'd be able to start admitting again, but that's not a guarantee. I don't think the CNA is a training program, is an excellent tool and is a great piece of the puzzle, but it's not going to solve the whole puzzle. Where there's just not enough people in the world that want to do the job at this point, but hopefully that would help. It may be able to have us open more households, but I can't make a direct connection between the two. In terms of space for the CNA training program, we do have a classroom type space that is actually part of Arrowhead, is where we've had the CNA training in the past, but it only takes up one part of it. We would still be able to have the households open if we did have the training program. If we had the staff.
Fireside, it was just closed. How many staff were actually in Fireside? It wasn't full, was it?
No, So Fireside was not full. Before we closed it, we had 8 residents down there. So depending on the time of day and the day, we would have a nurse, and then a CNA in that household. And then at night, it would just be at knock shift would be a CNA. The nurse splits the whole building, which is our standard practice. So it does alleviate a nurse and a CNA on each shift besides nights. It was actually a discussion on which household would be best to close. Fireside is our short-term household, which is where we get more reimbursement. So it would be great to have it open. But when we looked at closing other households, we did talk about a different household on campus of potentially closing. We chose not to, as it wouldn't alleviate a nurse. So in the outer 2 neighborhoods, the nurses split one household. So it's 2 nurses per the building on day shift and PMs. And if we close one of those households, we would still have to have 2 nurses. So Fireside alleviated the most staff to help with the situation.
Thank you. Oh, thank you.
If I could just offer a tiny bit of additional thought or information for your consideration as you think about this item. One would be that, so the budget sets the top of the spending authority for, like in this case, NDC. So if, I'm just gonna use simple numbers, if you said they could, we anticipate there's going to be $1,000 of expenses and $1,000 of revenue. And over the year, they spent $900 of expenses and received $1,400 of revenue. It doesn't require a budget adjustment because they're not spending the additional revenue. If, however, you budget $1,000 of expenses and $1,000 of revenue, and mid-year your expenses are running at $1,200, the department has to come to you to ask for a budget adjustment. They don't have permission, essentially, or authority to spend over what the cap or the top is of what you said. Now, let's take one last scenario and say that they had $1,000 or they had $1,100 of expenses, but they had $1,500 of revenue. They still have to come to you for a budget adjustment because they can't spend over what that top level is on the spending side without having the approval of first your standing committee and then the county board. So it is a bit administratively more complex to lower the number and then have to change it mid-year. Not impossible, but more. And the other thing would be, just to recall, we are still sitting on about $300,000 of provider relief money, which was federal money that came through with COVID, can be used for lost revenue, can be used for anything that's COVID related, and needs to be spent, I believe, by the end of 2024.
Thank you very much. Don, did you have something? Okay. Like I said, I wanted to bring this up because we've never discussed it before with 4 different board members here. Give you an idea. So right now, this moment, basically, we have budgeted 87% for the year, and it's 73% occupancy. Next year, I don't think it's going to go down from 73%. I'm optimistic that some of the things that we're doing going to go up. But Jane and Carmen did recommend going from the 87 down to 85. And I kind of think that's okay. If that's okay with you, Sean.
Yes, the 85 gives us still a buffer, so we're dealing, we're not coming up to those caps where we have to keep going back to the board. But it does bring it down more in line, considering we're probably going to have Arrowhead closed, so it would make it more of a realistic number.
Okay, thank you for putting that on there, Carmen. Like I said, it was a good discussion and a little better understanding of what it's like. And Chris, thank you for adding that in there, and it must hurt. 7C.
Okay. So there is a staff report in your packets that you should have received. I think Jenna also printed off extra copies for me in case someone didn't have it. So there is actually two staff reports in there. The first one I'm gonna go over is the year-end balance and capital improvement at the neighbors. So this is something that we've been talking about both through finance as well as Chris Corpola, county manager, regarding our process for capital improvements at the neighbors, as well as the year-end balance at the neighbors. So when we came to the audit this year for NDC had a profit of $1.3 million at the end of last year, so fiscal year 2021. And when we were doing this process, that $1.3 million then went back into the general fund. And then what we're finding puts us kind of in a tough situation is then the neighbors doesn't have any money necessarily earmarked to then go back into the neighbors. So this report kind of went over what we're currently doing, a history of this, as well as some different options that we think are available to maybe better the situation, or of course, the last option would be to also keep it how it is currently. So a little bit of history for any new county board supervisors on our committee is the NDC's bonding situation has been discussed at length over the past couple of years to figure out the best way to have it on our books for as the county and the neighbors for the NDC's bond, as well as it had a refinancing. During this process, what was basically decided was how the bond was going to be processed was that NDC was not going to have the bond on the books, that the county was covering the bond basically, and that we were only showing the operations on our financial statements. It is still on our books in terms of like our Medicare cost reporting and things like that, since it is an asset, but we are using it more as we are using our operations on our financials, and then the bond is in addition to that. And then how it's been done in the past is then if NDC does make a profit, whatever that profit might be, then goes back to the general fund. How NDC is currently doing CIP projects or capital improvement is we are requesting through the CIP process. That's typically done through that CIP workshop earlier in the year, and then having those processes approved by the county board, or the projects approved by the county board, and then put into the next year's budget. Currently, all of those projects are being put into the budget as operating costs, basically using fees to fund them. So if the neighbors doesn't have a great year financially, then those things are not occurring if in the current year. But if we have a good year, say 2021, for example, had a good financial year and had excess money, and that money then goes back into the general fund, but then say 2022, we don't have enough money to cover the CIP projects, they're not occurring. As you're well aware, things like our bus that is aging, as well as our building itself has reached 10 years. So there are things that need to be fixed and repaired, and we're not having the money to do those things depending on the year, and we're waiting for that to kind of see if we have the money at the end of the year. So the three options that we presented in this report are, the first option would be to have NDC participate in the CIP process, how it is currently done, which we are currently doing, but then instead of having the neighbors have it via fees, it would be, and this would take county board approval, but would be to carry forward the amount of the approved projects from any profits that the neighbors has for the year. So for example, this past year, we had a $1.3 million profit at the end of 2021. I'm just going to use an arbitrary number. Say we had $50,000 worth of CIP projects that in 2022 that we wanted to do, and that was approved by the board through the CIP process prior to the budget, that $50,000 could be carried forward from the 1.3, and then the rest of the 1.3 would go back into the general fund. So it would allow for the projects to occur with using profits that the neighbors made from a previous year, and only for things that were approved through the CIP process. That would be the first option. The second option would be to have NDC put all available cash into the general fund, which is what we're currently doing at the end of each year. But then instead of having the CIP process, have the neighbors use fees, we could then use the CIP process like any other department of the county and have it be approved as part of the process through the general fund. So this would be money going in and out of the general fund as available. And then the third option would be currently doing it how we are, which would be putting all available money back into the general fund and then budgeting using fees and having it be more of an operating cost instead of a capital improvement project. Like I explained previously, this puts us in a little bit of a tight situation where, for example, this year we had a bus approved through the CIP process, but we don't have the funds available, so we're not purchasing one. Next year it's approved and we have the funds available in our budget, so we will be purchasing one. But it kind of then depends on the year if we have funds available versus kind of saving money from the previous year to do the next project. I also put on there the next steps. So this would be a recommendation from this committee to the Committee on Administration, as it would be an ordinance or a resolution change, and then it would go to exec and then county board. Does anyone have thoughts or questions on this at all?
I think there's some thinking going on.
Mr. Chairman,
Yes, thank you, Supervisor Breslin.
I like the idea of option one, which is great as long as there's a surplus in the budget at the end of the year. It would seem more viable to go with option two, just in case we had a bad year. The capital improvement projects have to be done. I mean, you've got to keep the building up to code. You got to repair what is there. Otherwise, we're not going to have anything going forward. But if we don't continue having good years, option one doesn't put in for, let's say we didn't have money to put into the general fund and we have $100,000 worth of a boiler repair or something in the heating. I think option two seems to be the most viable long-term. That we put the money back into the general fund, we do the CIP process, and then we just pull it out of the general fund or just treat it like any other department. That's
Chris, do you have any comment you'd like to make?
So just a little bit of history. When you heard the audit report last night and you heard April Anderson refer to highway and NDC being an enterprise fund, in their purest form, the idea was that they would essentially spend what they made. That they operated most closely to a business of any county. The phrase has been used, if governmental operations were business, we would be out of business in 2 months. Because practically there's a lot of things that we do typically in government that there isn't a funding source for, in the sense of like a fee or a charge for a service. However, for the enterprise funds, the idea was that they would spend what they made. We kind of mushed, collectively as the county, kind of mushed that around when we built the new facility. And as Carmen has eloquently stated before, essentially said, we're building a new facility, but we're starting from ground up and you have to cover all of the debt, and we're going to take your old facility and do something else with it. Whether that was the right decision or the wrong decision, it was the decision that was made at the time. So then when the debt moved in 2020, then that kind of created this a more mushy enterprise fund. And so at this point in time, I think it's all kind of, we're creating it as we go. We did go back and try to replicate the thinking, watching old meetings, reading old minutes, trying to sort of sort all of that out. What was the intention? It's murky at best, at least in terms of the written and sort of documented information. And so I think it's a great conversation to have now and to make a recommendation about it going forward. I think Supervisor Breslin's comments are spot on. I like number one a lot as well, because I think it creates a nice sort of rub to be fiscally responsible, but if there's extra money, to know that that's going to cover some expenses for continuing upkeep. However, you're right, if things go into a decline, then there would be no money. Now, what I would point out is that if you recall that document that's got the 10-year history, in all but 2013, the neighbors did have an operating profit. And so if you take out depreciation, which is not actually an expense, and you take out the debt service, which now is gone from their money, they were operating in the black all of those years. So in varying amounts, sometimes I believe Carmen might remember, but it may have been as little as under $100,000 and up to and including last year, which was 1.3 million.
Thank you very much, Chris. Supervisor Keeter.
Yeah, I came on the county board about the time Neighbors opened for operations about 10 years ago. And I never did quite understand the relationship between the Neighbors and the county, because they were supposed to be independent and charged for depreciation and stuff, and yet other county buildings weren't under that obligation. But I guess that's the way it was decided when they built it or something anyway. So I was kind of surprised, because it seems to me in most budgets, we always contributed money towards the, it didn't show that they had a profit, at least my understanding was, because we'd contribute towards the operation of Neighbors, and that must have been for depreciation or something. I'm not sure.
I can add, that was, it was a combination of depreciation as well as the bond. So when the bond was removed from the Neighbors budget, that was the big difference of if we were making a profit or not. So from straight operations, it's making a profit every year, but but when bonding and depreciation are in there, it does not. So the bond is, before the refinancing, was $1.6 million a year.
Yeah, so I was kind of surprised to see that we had to turn back 1.3 million. I figured too, well, gee, they ought to keep that because they're in such hard straits all the time. Because I think generally the way the budget showed it, we would usually contribute about $500,000 towards, am I wrong there?
No, you're not wrong. So prior to the construction of the new facility, the county had passed a 5-year referendum. Not the county passed, but the public passed a 5-year referendum to contribute up to $500,000 of county levy towards operation of NDC, which wasn't NDC at the time. And then when the new building was constructed, then that went away. That sunsetted.
Okay. Yeah, I guess I'd be in favor of either option 1 or 2, and 2 might be a little safer, because if there is a bad year, then we could still go back and get some money for repairs and things. So, but I think either 1 or 2 in my estimation would be okay.
Supervisor Breslin. Thank you, Supervisor Keeter.
Thank you, Mr. Chair. Is there a way we could put in option 1 that if we do have a negative year, we'll go to borrowing? Because it makes sense for us, the Neighbors, to use their profit for their improvements. They keep it there, they earn it. It's just the same thing we all do here in private business. You get to keep what you earn. But if you have a bad year and you need to do something, then you either, you go and ask for a loan or something. Maybe that would be the best thing, especially if they've been having, a budget in the black for 10, most of the 10 years.
So they're kind of the same thing. In reality, if you think about it, let's just take this last year, 2021, for example. In 2021, when they had a $1.3 million profit that dumped back into the general fund. Let's say that in 2020, there had been option number one, if they, or going into 21, option number one, they had $250,000 worth of CIP improvements approved. If they had come to the end of 2021, had $1.3 million worth of profit, $250,000 of that would have gone to the improvements, and the rest of it would have transitioned back to the general fund. The only difference really between that I see between 1 and 2 is 1 probably feels perhaps slightly more palatable to the remainder of the budget decision makers, to basically say, it gives them a little bit more say to say, well, we would do this if profit existed. And that we're not on the hook if it doesn't. 2 essentially says, like you said, Supervisor Breslin, if the CIP project is approved and it's part of the list of projects along with all the other departments, it will happen then for sure the next year. So I think a little bit of it is just thinking through the I don't want to say saleability, but essentially the ability to buy engagement from the remainder of the board about, you know, what, given how fluid the whole funding has been over the years and the changes on the board and the lack or limits to the documented history of how some of these decisions were made in the past. I think it's worth thinking through what might settle best with your partners on the board.
Supervisor Bjork.
Thank you, Mr. Chairman. I might get far afield again here, but sitting next to Alton Christofferson for 5 years on the county board, first thing I can tell you is that he always had glowing praise for Carmen, just, you know, total confidence. But the one thing that bothered Alton was, for example, what is the footprint of the neighbors? And he always assumed that the footprint of the neighbors was the property that used to be the Dunn County Healthcare Center. So when it came along that the medical facility built on neighbor's property, that the sale of that property to the medical facility, I think, went into the county budget, which is, I don't know how it reflects to this, but I think about that as an income. I think of taking down the smokestack, and that work is, you know, what responsibility as far as who, where is the footprint for the neighbors? Is it the previous, and does this make any difference in what we're talking about here? I mean, if we sell property that was part of the healthcare center, why can't that be used as a cushion for the neighbors? Or if you take down the smokestack, is that a neighbor's expense? I'm just,
Okay, so is your question,
well,
what's neighbors responsible for when you
yeah,
say footprint?
as far as dollars, we're talking about dollars and cents here, and if you make any money, if you sell part of your property for $5 million or whatever it is, you know, is that, you know, that was not termed as neighbor's asset. Elton thought it should have been. Or if you take down the smokestack that used to be part of the healthcare center, is that a neighbor's responsibility or the county responsibility? I mean, where is the shifting of well, I guess I don't know. It's just that I didn't know that he was concerned about it, and I didn't quite understand it. So maybe it doesn't relate to this at all, but
I can speak to that a little.
Well, just for just a second, Carmen. Yeah, it is a little confusing. But I think Chris mentioned it's an enterprise fund. And the question is how close do you keep it? How much of a business do you keep it? That's kind of what you're asking, I think.
yeah, really.
Okay, yeah. Now, option one, I have a question maybe for Carmen or Chris. Does that give the neighbors a little bit more control over what they would do as far as a capital project? Or do we still have to go through the capital project process?
We would still go through the capital improvement project process. So the whole workshop that we do to have capital improvement projects approved for every department, we would still do that. It would just be, so say we had 3 projects and it totaled $100,000 for next year. And they would have to be approved by the county board still. So the projects would still be approved, talked about, money talked about, all of those things. It would just be then whatever was approved. If we had that amount of money or more left over at the end of the year, we would carry forward that amount of money, just the amount that was approved in county board. So if, say, we had 3 projects, 2 were approved, 1 wasn't, we would only carry forward the amount for those 2 if we had it available. So we would still go through the whole process. It would just be the funding for those projects would change from currently being fees or operating revenue.
Okay, so I understand what you said then, Chris, a little bit more about more easily digestible or understandable or agreeable to someone else, because if I'm approving a capital project and it's coming out of the entire budget, I might think differently than if, oh, that's the neighbor's budget, that's separate. I'll approve that. And if they've got the money, great. If they don't, it's their problem. Although I wouldn't put it that way. But oh, interesting. Supervisor
Yes.
Breslin, yeah.
Carmen, which one are you, which option do you favor?
I would favor the first option. That would be my recommendation. It is still ultimately county board decision, which one it would be. I would favor the first option. As Chris noted, it is probably a little bit more favorable for having the general person that may not sit on this committee approve, as well as it does allow us to utilize that funding that if we have additional revenues that we can utilize. In the case that there was something that say we didn't have a profit and there was something that desperately needed to be fixed and we couldn't operate without it, then we would go through the process of having a budget adjustment or some sort of request for a different CIP process. Say we didn't have the money and some tragic thing happened that ripped our roof off or something that we needed to operate. That would be a different situation. This is more for things like the bus, for example, or things that we really need, but our operations aren't going to stop if we don't have, would be the idea for this.
All right, thank you.
Chris Carpula?
I would just go back to Supervisor Bjork's comment. Larry, I don't think that you're confused as much as you think that you're confused, because I believe that the whole history is a bit confusing. It goes back to that sort of that mushing of the lines between strictly a business and county operations. And that's gotten watered in many different directions over the certainly last decade or longer with the RFP or the referendum before that. So I don't think there's an answer to your question, but I don't think that you're the only one who would be confused.
Yeah, thank you. I think there's more than just a couple of us. Supervisor Keeter.
Yeah, I'm glad to hear what you said, because it has been mushed together. And to me, I've always felt that, okay, the neighbors is a county is a service that we offer to the residents. And I guess, and I realize there was probably some political considerations when this passed, but because they had to keep it separate or something, but it seems to me that it's kind of like I'm on the library board, and that's kind of like that too. It's not really a city function. The trustees kind of own it in a way, and yet we rely on the city for accounting and all the other things. And maybe that's the way it is here. But it seems to me it'd be a lot simpler if we just completely mush it together. It's a county operation and the county's responsible for it. but that probably won't happen, so.
I believe that the history to the thought of an enterprise fund were things that were in essentially could be completed within the private sector, but that were chose to be county operations. So back in, through the late, whatever it was, 2018 or 2019, when we eliminated home healthcare was considered an enterprise as well. Essentially, they were to operate on their own. And that was part of the reason then why that function was closed, was because they were each year having to dip further and further into county funding in order to stay operational. So the danger of making it all, I know danger is a strong word. The caution of making it all one function is that I believe it creates maybe no more or less, I don't know, but it does create some vulnerabilities because you have that piece that it can be provided by in another way. And things like, I'll just think things out of my own old arena: child protective services, adult protective services, behavioral health, emergencies, those sorts of things only county government can do. So if you mush it all together and there isn't enough money, essentially I believe it leaves NDC more vulnerable. It feels smarter to do a really good job now of defining what the lines are going forward and documenting that, so that 10 years from now, when we're all on a beach and somewhere, except Jenna, she has to keep working here, so she'll remember this conversation. To start to try to say it is a bit muddy, and let's just try to clarify pieces of it for process going forward.
Yeah, thank you. And I still get questions on this, and the complaints are still, I thought they were going to pay for everything. So that's why I like option one. That's what they were promised, for better or for worse. I'm sorry, not they, that's what we were promised, for better or worse, going to pay for everything. So. And Carmen, you in thought option one, and Supervisor Witzel, thank you.
Okay, I was just going to mention too, it says paid for by either borrowing. That's the last word I even want to hear, is borrowing. If we can stick to option one, which I think we're all in general consensus, would be good, because we have enough debt and everything going on that we don't need to borrow at all. If we can go through the general fund, that'd be great. But if it worst comes to worst, we have to borrow. But boy, if we don't have to borrow, that would be, that would be a good option not to. Thank you.
Okay, thank you. It looks like we had a great discussion here, and I think we can just have a consensus. We'd like go ahead and proceed with option one then. And actually proceed, if things change, proceed with anything that works, but for what you have, your option one.
Sure.
That's acceptable. Looks like it's acceptable to everybody. Anything else you'd like on this one, Carmen?
Just so everyone is aware, so how the process would work is now staff would create, I believe we're still looking into if it would needed to be an ordinance change or just a resolution, and then that would go through from recommendation from this committee to administration, then exec, and then county boards. So this was just to get this committee's ideas and thoughts, and then a recommendation to then have a resolution or ordinance change. So we will work on that, and then you will see this through other committees shortly.
Thank you.
Mm-hmm.
And while we're keeping you today, legislative agenda, we had that in our packet too.
Yes. So this is an adjustment per request from last meeting. There was requests about adding and changing a couple of things. So this is a revised version of the legislative agenda. As we mentioned last meeting, this isn't necessarily urgent. So if there are more changes, there's more changes that can be made as well. So this will go to I believe in later in the fall goes to overall legislative agenda for legislative meetings later on and going through the end of the year and the beginning of next year. So this is a revised version, but if there's more revisions that you would like, I can add those as well.
Supervisor Breslin, did you get a?
Yeah,
Yeah.
it had all the changes I was looking for, so it looks great. Thanks, Carmen.
Supervisor Keeter, Supervisor Bjork?
Well, number 3.
Yeah, there you go. Great, Carmen. And if any of you do have suggestions, would you just like them to email you or?
Sure. Yeah, we have plenty of time for this, I believe. So if there is any ideas or changes, let me know and I can add them and then bring it back to committee at that time if need be.
Great. Oh, let's see. Adjournment is next. We have talked briefly about skipping some meetings now and then if there wasn't anything urgent. And Carmen, I think the 4th Thursday in November is never very good.
Yeah, that's probably not the best.
Either we'd have to change it or we can just cancel it. So let's consider, and we can decide at our next meeting, but let's consider canceling the November one.
We're having an October one.
So far, yeah, I think so. So we'll have an October one, but then we'll decide then what to do. But I wanted to give you a heads up so you can plan your deer stand even better.
I thought you were talking about here.
Yeah, okay.
Of course.
Anything else? Any other announcements? Great, we are adjourned.